Good morning. Thank you all for being here. Health experts, public officials, and residents across our region know that the current surge of COVID-19 represents an historic crisis. Just today, the Hamilton County Commissioners declared a state of emergency. COVID daily cases are at record heights and hospitalizations are leaving our region's hospitals at maximum capacity. And it's impacting our kids at record numbers. There is over a 500% increase from last month in hospitalizations for minors. When hospitals don't have the space, the staff, and the resources to keep up with the skyrocketing cases, Cincinnatians' lives are at risk. While the pandemic is surging, our ability to get any kind of health care that we need is put in jeopardy. Slowing the spread is absolutely essential to protecting our hospitals, protecting our residents, and keeping the city functioning. Each of us doing our part is as essential as ever. That means getting the vaccine, getting tested when you don't feel well, and wearing a mask to keep those around you safe. Last week, we announced new testing sites with partners around the city to improve access for our most vulnerable communities, led by Dr. Moore. Throughout this pandemic, Black and brown residents have been disproportionately affected by COVID, and addressing that disparity remains our top priority. Today, we are again taking action to slow the spread and make sure our city can provide the basic services that we all depend on. We, along with city manager and in consultation with our health department and regional experts, are announcing an emergency order requiring masks for all city employees and city facilities. This is a necessary measure to protect lives and ensure that the city staff is safe and able to get to work. We'll now hear from City Manager Paula Boggs-Muthing.
Good morning. I know we sound like a broken record, but the best protection against COVID-19 continues to be the vaccine. We know also that masking and testing helps to dramatically slow the spread. I actually said that to my 12-year-old recently, and he said, "Mama, what is a broken record?" I want to thank the mayor for his leadership in issuing this emergency declaration. While the medical impact on vaccinated individuals has been predominantly mild, given the rapid spread of the virus, masking and suppressing the spread will help us keep all of our employees safe and at work so we can continue to deliver basic city services. For many months, unvaccinated employees and those who haven't attested to vaccination status have been required to mask when indoors, in a vehicle with others, and when interacting with the public. This emergency declaration will now apply that requirement to all city employees. I continue to urge city employees and all of our citizens to get booster shots. We have heard from the CDC, our health department, and other trusted sources that boosters are very effective against the Omicron variant in ensuring that boosted individuals do not experience severe symptoms or hospitalization. To date, nearly 71% of city employees are vaccinated. Those who are unvaccinated or do not attest to their vaccination status participate in biweekly testing. Because city employees across departments are impacted, masking will ensure that those who contract the illness limit or suppress the spread of the illness. We continue to make every effort to ensure that employees stay safe and that city services are not impacted. I want to give you just a couple of employee or City of Cincinnati stats. Between December 1st, 2021 and January 11th, 2022, 700 City of Cincinnati employees have been reported with COVID-19. That is laboratory confirmed and probable cases. During the same time period, 383 City of Cincinnati employees have been asked to quarantine. Currently, that is as of yesterday, 57 people have been infected with the COVID virus. That's yesterday, COVID-19, 57 people out for it, and 61 people are in isolation. Since the reduced isolation and quarantine guidance released by the CDC has been applied to city employees, the Cincinnati Health Department has worked very hard to get as many city employees back to work as were eligible to be released early. The rate of COVID-19 infection in vaccinated city employees since December 1st, 2021 is 4.5% of all vaccinated employees. This does not include employees whose vaccination status is unknown. The rate of COVID-19 infection in unvaccinated city employees since December 1st is 8.5% of all unvaccinated employees. I'm now going to turn it over to Commissioner Moore.
Thank you, Mayor Pureval and Assistant City Manager Boggs Muthing. I want to start today with our positive case numbers, 761. When I think about that, those are newly reported cases, and that's an increase of 49.8% compared to yesterday's 508. 248.6 new positive cases per 100,000. That's an increase from 228.6, that 7-day moving average. Our testing that we're offering to the community, our community testing. We've been in business for 3 days now. Our first day, we were at our African American Chamber where we tested 83 people. Our second day, we were at Corinthian Baptist Church where we tested 183. Yesterday, we were at New Prospect Baptist Church and we tested 200. Out of those numbers that I just gave you over the course of the 3 days, we have a 16.5% positivity rate. We know that in our community, we have other partners who are also assisting with drive-through testing, and that's offered through our health collaborative partners and our hospitals. And thank you for all that you do and you continue to do in your workforce. We know that UC Health, which is at Albert Sabin Way here in Cincinnati, has a drive-through site. And Crossroads Mason Road has a drive-through site. And there are others that will be coming on as well. Just to give you a little glimpse into the hospital regional report, we have 981 confirmed COVID positive patients in our regional hospitals. That's 2.4% increase from 958. 175 of those individuals are in our ICU. Little bit of a decrease from 179. 133 on ventilators, and that's an increase from 126. And 101% of our adult beds occupied have an increase of 99%. 98% of our medical surge beds are occupied, and that's an increase at 97%. 83% increase from last week in hospitalizations, admissions for patients in this age range of 0 to 17. Now that's a 540% increase from last month in hospital admissions for patients in that same age range, 0 to 17. Parents, my Cincinnati residents who have children, please get them vaccinated. It is so important. When I look at our county numbers, 0 to 19, 26% have completed their vaccinations. Cincinnati, we can do better. Let's get vaccinated, let's maintain social distancing, and let's wear our mask. And let's be cautious. Thank you.
Thank you, Dr. Moore. Next up, I'll ask John Ward, the Senior Vice President of Bethesda North Region Tri-Health, for some brief remarks.
Thank you, Mr. Mayor. Good morning. We're 22 months into this, and we're seeing more COVID patients in our hospital today than we have in the entire pandemic. When you look at the patients in our hospital, 90% of those that are in our ICU are unvaccinated. 80% in our med-surg areas are unvaccinated. More people today in the state of Ohio are dying of COVID than any other time during the pandemic. Over 100 a day are dying. That's like 2+ bus crashes every day with no survivors. We have got a very stressed workforce. They are stressed, they're burnt out, they've been dealing with this for 22 months. They need your respect. In addition, we are seeing difficulties in getting what we need to provide the care that we do on a daily basis. Our bed, as what was mentioned, we're short on beds, so we are working on surge plans, which will be very difficult to enact, because what's different today than any other time during this pandemic is the extreme staffing shortage that we are seeing across our industry and all industries across the U.S. We're having to enact more strict visitor policies. While we have tried to be very compassionate through this entire pandemic, we've got to protect our staff, because more and more of our staff are going out daily because of this Omicron variant. Other things that you can help us with is we're starting to see that our visitors on occasion are getting confrontational. They too are extremely tired and stressed from this pandemic. And our workers, our healthcare workers, our nurses, our physicians need their respect. And we ask you to please be calm and patient with us. Because of the staffing shortages, it is really difficult to provide all the care that we can provide and all of the support for the families while we're dealing with this pandemic. So what can you do? Mask, vaccine, boost. We know all those things will definitely make a difference. Also, if you are feeling symptoms and you're coming to our EDs just to get tested, I would ask you that go to one of the drive-through testing centers and get that test, and don't just come to our EDs to get tests, because they're overcrowded and extremely busy. We need your help, we need your support, and we definitely need you to support these incredible healthcare workers, these heroes that have been getting it done every day for 22 months. Thank you very much.
Thank you so much, John. Next up, Julie Holt, Chief Nursing Officer, Christ Hospital. Thank you.
Thank you. Good morning. I have the privilege and the honor to be here today representing the Health Collaborative, our area hospitals, and most importantly, I think, our frontline nurses and our frontline clinicians. I am a registered nurse. The last 22 months, as John mentioned, have been extremely challenging. Today, as we said, we have almost 1,000 people hospitalized, and the numbers are continuing to go up. Our healthcare system is in crisis. People have said to me, what's different now? Why is it a crisis now? We've been through this before. It's a crisis now because we have widespread labor shortages in all industries. But it's especially exacerbated in healthcare because of the fatigue that everyone has mentioned, burnout from all the deaths that we're experiencing, increased workloads and acuity of the patients that are in the hospitals, and then the personal illness and the family illness of our staff, which sometimes makes them unable to come to work. Today, our hospitals are stretched at critical staffing levels, and we are quickly approaching a crisis in our staffing, and as John mentioned, developing surge plans to manage that. Cleveland and Toledo have already experienced these surges at a level, and we know from them as we communicate with them and learn from their situation that their significant staffing shortages in their hospitals are resulting in very high nurse-to-patient ratios, which is something that we've never experienced here in the Cincinnati area. So what does this crisis staffing mean to people who have to come to the hospital? It means cancellation of non-emergent surgeries and procedures, especially those that require hospital beds, increased wait times in the ED, And most concerningly, those increases in nurse to patient, what we call nurse to patient ratios, the number of patients that each nurse is assigned to. Patients come to the hospital and are admitted to the hospital for nursing care, meaning they need someone to be with them most of the day to help them through their acute illness. When nurse to patient ratios go up, we're limited in the care that we're able to provide. So things like baths and linen changes and some of the nice things that we like to do for our patients, we cannot do. And it can even challenge some of the things that we have to do for our patients. I'll just give a quick example. In Cleveland, the RN to patient ratios in the ICU, which is it's the same for us, is usually in normal operations 1 nurse to 1 to 2 patients. In Cleveland, they're experiencing 1 nurse to 3 to 4 patients, and in some rare instances, even more than that. So we're preparing for those types of nurse to patient ratios. In med-surg, normally we have 1 nurse to 4 or 5 patients, and we're looking at possibly 1 nurse to 8 to 10 patients. So you can understand the level of strain on those caregivers. So thank you for the opportunity to share what we're experiencing in the hospital and what we're trying to prevent. All of this being said, we are here for the community, and we certainly don't want anyone to delay care. We would like people who just need testing and other things to not come to the hospital. But if people are very sick, they should come to the hospital so we can address their conditions as soon as they can. But as the numbers increase, there are concerns, and we're here to ask for your help today. Thank you.
Thank you so much, Julie. John and Julie, on behalf of a grateful city, thank you so much for your incredible work. To your colleagues on the front lines for the last 22 months, we are so incredibly grateful for your public service and for lifting up our community in these really, really very challenging times. Thank you so much. Please convey our gratitude to all the healthcare workers and frontline workers in the hospitals. Folks, getting vaccinated, getting boosted, wearing a mask, it saves lives. As you've heard today, we are at a crisis point in Cincinnati and across the state. We are doing our part today to take action. In addition to the testing sites that we announced last week, we're announcing this emergency order to protect our basic services, but also to convey the urgency that city leadership, that our healthcare executives feel is warranted. We're also announcing that Commissioner Driehaus, Dr. Kesterman, myself, and Dr. Moore have joined with the Health Collaborative and the healthcare CEOs to be briefed on a weekly basis so we can understand how the spread is affecting our hospitals and take further action if necessary. I know that we've mentioned we feel like a broken record, but this is a new crisis in this pandemic. I just yesterday was on a Zoom call with healthcare CEOs, and these folks are unshakable, steady, strong leaders in our community. They've seen it all. And on the call, I saw that they were legitimately worried, that they're concerned that what's happening in the northern part of the state will happen here unless we take action. So we're, again, asking the community to take this seriously, to help take the burden off of our hospitals by wearing a mask, getting vaccinated. If you need to get tested, please use the testing sites that we've announced in the community or the drive-through testing, and not further creating capacity issues at hospitals in the emergency rooms unless you need it. With that, we'll take your questions.
Mayor, your language and the language that I'm hearing from county leaders and health leaders in the past 24 hours has been more dire than any time I can remember. And on the county call just a little bit ago, the health commissioner, Greg Kesterman, was saying he'd like to see, all this is coinciding with the big dengue scheme. He'd like to see people wearing masks in between sips of beer. The CEO of Christ Hospital would like that maybe you think they should take?
We have had communications with key people in the business community. In fact, I've got a statement here from Fifth Third that I'd like to read, because we've been consulting with our business community throughout this pandemic, in addition to our healthcare professionals. And it reads, "We are proud of Fifth Third Bank employees' continued commitment to acting in accordance with health and safety protocols and their ongoing dedication to protecting each other, our customers, and communities. As one of the very few banks that was able to keep our local retail locations open throughout the pandemic, on January 3rd, 2022, we asked all our employees to wear facial coverings while in public spaces at any Fifth Third location across our national footprint. We believe it is prudent to take additional precautions at this time." Look, the business community is largely in line with these precautions that we're taking today. I'm a massive Bengals fan. I'm incredibly proud of the team's accomplishment, winning the AFC North and hosting a home game against Las Vegas. I'll be tailgating outside. While tailgating, I'll be wearing a mask. I'll be attending the game in the open air, and while attending the game, I'll be wearing a mask. Look, if you are vaccinated, if you are boosted, if you are wearing a mask, going to the Bengals game should be a safe activity. And if you've taken the responsible precautions to do those things, getting vaccinated, getting boosted, and getting a mask, then I think you should feel comfortable doing it. If you are unvaccinated, you are putting yourself at risk, and you're putting the community at risk. And so as was mentioned earlier, we're seeing in our hospitals over 90% of those who are hospitalized are unvaccinated. This is now a pandemic of the unvaccinated, and the stress that is being put on our local hospitals is due to those communities that are currently unvaccinated.
Mayor, it's been said many times in the last 24 hours that the pandemic is worse now than it's ever been. And yet, previously in the pandemic, there was a public mask mandate in Cincinnati. Why are you not recommending a public mask mandate when the pandemic is worse now than it was previously?
Yeah, in consultation with our public health experts, we are taking action today to try and stop the spread, to flatten the curve. Obviously, we will be monitoring that very closely, and if further action is needed, we'll be prepared to do that.
Yeah, I was just kind of asking the same question because only a small proportion of the population lives in the city of Cincinnati. When I'm here, most people are wearing their masks already. So do you see this making any difference?
I do. Yes, I do. It's a further indication of how seriously the city is taking this. I urge private businesses to use their discretion to require masks to all of our citizens of Cincinnati to wear a mask when they're out amongst other people who are not in their family pod, to again work together to stop the spread.
Pardon, I may have missed this. Is the public required to wear a mask inside all
Yes,
facilities?
absolutely. Go ahead, Becca.
Could we hear from our
Sure.
the health experts? What is your opinion on a public mask mandate? Do you think it's time? We've heard from others saying yes, it is time for another public mask mandate. What's your opinion on that?
Well, from my, again, from my perspective, if you're vaccinated, if you're boosted, I think you should wear a mask. I'm not here to say it needs to be mandated. I can tell you in our hospitals, we are requiring a mask, not only for our team members, but also for all those that are visiting. It's critical to stop the spread. The Omicron variant is extremely contagious, way more than the Delta variant was. And so all of these precautions are going to help stop the spread, and that's our concern. Because, we also know that I've heard many times that well, it's not as virulent as a Delta, so why are the hospitals having a problem? Well, the numbers are so great. Even though the percentages of those that are ended up in the hospital is smaller, it's still a ton of people that are ending up in our hospitals and taking up all of our beds.
For the health, our hospitals too, you guys are talking about staffing shortages, but is there a way to quantify that? I mean, we have 100 nurses out every day. How does that actually look for people at home and just hearing staff shortages? What does that actually mean?
Well, we all do have. Sorry about that. We all have people out ill right now, and it changes hour to hour, day to day. We staff very fluidly. Our volumes change hour to hour and day to day as well because we don't know exactly who's coming into our emergency room. So it's very hard to quantify a specific number at any moment, which is why I explained how the ratios will change as the volume of patients continues to go up. So there will be less nurses for numbers of patients.
We all know it's going to be a great celebration with the Columbus Day. The bars are expecting to be packed, shoulder to shoulder. And listening to the county officials, the health officials, the city officials, the hospital people, I'm hearing wear masks no matter what. And yet the bar owners tell me there's no way to require this. So what?
John, let me just say this directly. If you are unvaccinated, if you are not boosted, it is not a good idea to be congregating in large groups inside. It's just not. If you are vaccinated, if you are boosted, if you are wearing a mask, as I am and as I will be celebrating at a tailgate. I will be going to the game at the stadium to root on our Bengals. But if you're unvaccinated, you are posing a risk to yourself and to others, particularly if you are unmasked and indoors in large groups. Thank you so much. I appreciate it.